is once again posing a scare in the Delhi NCR region. We've seen 3 schools at least shut down in the Noida region. And today there's a case that has been reported in a private school in Delhi as well, where a teacher and a student have tested positive. The national reopening of school guidelines were laid down, but schools are showing a knee-jerk reaction when it comes to new COVID cases in children in school. To get a doctor's perspective, I am with Dr Dhiren Gupta, who is an ace pediatrician, intensivist as well, and consultant at Sir Gangaram Hospital, and a sane voice who has been spearheading the cause for children and looking at various cases of children with COVID-19 during the pandemic in India. So thank you so much for joining us. First of all, I want to ask you, is it a cause of concern that children are now testing positive? And should schools look at this knee-jerk reaction that they are shutting down, classes are going online all of a sudden because of a few cases that are coming forward?
I think you have answered your query that it is knee-jerk reaction. First of all, number of COVIDs are going to come, cases are going to rise, right? And we know that it is going to be an endemic. Endemic means which persists during between pandemics, right? Second, if you look at the past 2 pandemics, means first, second wave, there was rise in April, May, June, and there was fall. So same virus is taking the trend, means it's the same trend. But because of school opening, it must have added little bit fuel to the fire. That's it. Secondly, when we talk about this virus, this is not at all fire, because it is not producing major symptom. It is not producing morbidity. It is not producing mortality. We have seen in the past a BA1, BA2, and this is BA2, and this is not going to produce mortality, morbidity and mortality. And moreover, many adults are already vaccinated, or they were infected in the previous wave. So we should not worry at all presently. Secondly, NCDC is keeping close watch what type of strain. If new strain comes, or if the same strain looks like it's carrying more mortality, then it's a different issue. But presently, it's a knee-jerk reaction to close the school. Already kids have suffered a lot. Whole generation has been spoiled. Just because of COVID.
So you just mentioned a new variant. So XC and XM are the few new variants that are being witnessed right now. There were reports, unconfirmed reports from Mumbai that's still been looked into, and one coming from Gujarat. But if people are getting infected with the XC variant, are there differences in the symptoms, or is it something different from what lineages we've been looking at through Omicron, BA1, BA2?
Yeah, presently we don't know how the XC, E, F and all these are going to behave. They are either combination of BA, BA1, 2, or they are combination of Delta, but the entry point is like BA1, which is a benign sort of thing. Secondly, if you look at the US data, if you look at the UK or Europe one, even BA1, BA2 was much benign. Benign means it was much milder as compared to the same virus which was there in the UK and US. So our population is entirely different. But of course, if new strain comes, we need to be little bit more cautious. That's it. But presently, this virus is benign. This virus was benign, and we should not land up in closing any business, saying any tourism, anything, any public vehicle, any public transportation, and especially schools should not be closed.
So, but schools are closing as a knee-jerk reaction. So, and another concern with parents is that for less than 12 years of children's ages, there is no vaccine at the moment. India has not really looked at a vaccine, although trials are happening. So, should we now start looking at a vaccine for those less than 12 years? Because ultimately they require protection. And we still don't know, when children are infected, what are going to be the possible outcomes due to long COVID.
See, presently we don't have vaccine for this age group, right? But if you look at this age group, even if they are infected, they were never exposed to the COVID. Now they are going to the school, probably might be coming with the COVID. But look at, there's a herd immunity has developed. Especially with the previous wave has just gone. So many of the adults were already either vaccinated or got infection, as well as adolescent either got infection in the previous wave or were vaccinated. Now this chunk which you are talking about is actually covered by, surrounded by the people who were either infected or were vaccinated. So you are already protecting them.
So you think herd immunity has developed by this point in India?
Must be to some extent. Now, even if you leave aside that there is no herd immunity, because we know that BA, 2 are very notorious and they can reinfect. Since it is like a viral, it is like a very simple influenza infection. They are very mild. So why we are worried? In a house, if some pediatric age group 4 to 12 year get infection in form of fever, don't send him to school.
Just keep him at home.
It's like any influenza. In influenza or any viral infection, we don't send our kids to school if they are not well. The same principle should be applicable to this age group in the present scenario. We should not worry about this COVID BA1, BA2 presently in the present scenario. But of course, if somebody is infected, don't send him to school, like in influenza. And take a boosters. If you hasn't taken boosters in elderly or high risk group, taken booster and be little bit cautious. I'm not saying that be very lax. Of course, you are going to apply mask. You are going to take some COVID related appropriate behavior. So that should be taken, and otherwise we should not be worried.
So finally, you said masks, but states like Delhi, Maharashtra, UP, lot of states said we don't need masks to be made mandatory anymore. And there was a disaster management guideline that came out that said that masks are not mandatory in public spaces. Do you think all the health authorities have acted in haste in removing the mask because that was one protection that people were wearing at least when they had to follow the rules and regulations?
If you do soul searching in ourselves, everybody was fed up of mask. When you got news that no mask, oh, what a relief. But situation changes. So with this new situation, there should be guideline that, okay, mask should come again. Yeah.
So certainly masks should come back again. All those children do wear masks inside classrooms, but they are still testing positive. But doctors say that the knee-jerk reactions that most schools are showing by shutting down the entire premises will affect the health and the mental health of students who have not been able to go to school throughout the pandemic, and guidelines need to be followed. It's time that we look at this coronavirus as something that will not go away quickly, and therefore instead of shutting down the entire school, maybe classes could go online for a few days till the chain of transmission is broken. But certainly closing the schools is not the answer to living with the virus. In New Delhi, this is Milan Sharma for India Today.